workers. Thank you. And my wife's a doctor. We talk about this issue all the time. This COVID pandemic has created havoc across probably every family has felt it. We have mental health issues. We have labor shortages in our healthcare workers. What we don't have a lot of shortages in is administration. Administration is everywhere. This is what government does. This is why I'm standing here in front of you, is to fight this issue of growth in administration, of growth in bureaucracy, and nothing being done to serve the people of British Columbia. Look, you can't get a psychiatrist. People are flying to New York to get a psychiatrist. We don't have enough people helping people that are addicted. We don't have enough people with mental health issues. Our operating rooms are at the breaking point. Nurses are having nervous breakdowns. Nobody wants to be there anymore. So yes, I think we need to eliminate administration, reduce it, and start working on getting more people. We need to bring people to this province from other countries that are qualified to serve the people of British Columbia. We need to do everything we can to start giving service to British Columbia.
That's time there. Thank you so much. And now next to you, Val Litwin. Go ahead. You have 60 seconds.
Yeah, thanks, Richard. So I used to work at a very high level in elder care, and my wife is a nurse, so these are lively conversations we're having around our dinner room table. Our healthcare system right now is in absolutely urgent crisis, and I take my hat off to all the people in care, the nurses, the doctors, the carers, the frontline workers that have been doing so much, but we are in serious crisis right now, and we're standing at a dangerous crossroads. So we need to do a couple of things. We need to totally rethink primary care so doctors aren't just wanting to walk away from their business. That's how we get more doctors to support people here in British Columbia. Patients right now, they can't be getting timely appointments, so we need to flood the zone with our healthcare system. We need to be training up great people to make sure we can eat into those wait lists. And look, British Columbians still don't have control of their medical information. We need to put British Columbians in the center of their care experience. My approach is going to focus on access, on outcomes, and the sustainability of the system, because the life we have to save here, Richard, is the life of our healthcare system.
All right, next to Gavin. Again, you'll have a minute, and just focus in on the next question here and whether you would consider as leader potentially for profit options and what other options in the healthcare system. Go ahead, you have your minute.
Richard, look, in order to improve our healthcare system after COVID, we need to learn the very expensive lessons of COVID. That is why 261 days ago, when everyone else on the stage was silent, I started calling for a constructive public inquiry into the medical and economic handling of COVID. It is long past time that the conversations in the legislature catch up with the conversations in the community, where people are talking about the day-to-day trade-offs between personal freedom, collective safety, and economic impact. Under my leadership, in the first week, we'll do 4 things. First, we'll call for more proactive data disclosure that has been delayed for too long. Second, we will demand that the Select Standing Committee on Health is convened to provide oversight that has been withheld for 2 years. Third, we will call for a new Minister of Health to replace leadership that is exhausted and entrenched. And fourth, we will set in motion a public inquiry to make sure we learn the lessons from COVID and carry them forward.
That's time. Thank you so much, Gavin. And next to you, Ellis, you have a minute.
Thank you, Richard. And you know what? Before we get to the conversation of private healthcare, we've got to fix a system that's already in crisis today as we speak. In fact, if anything, what we've heard from nurses and doctors is that they need help. They need more nurses and doctors. In fact, if anything, what I've said is that we need to make a minister responsible for recruitment, not just here in BC, but in Canada, internationally. In fact, when I go back to Terrace and I go to Tim Hortons, I'm talking to a lady that's trained to be a doctor in India, but they're not allowed to practice medicine in Canada. They're not allowed to be a nurse. We've got to think outside the box in this. And I do understand it's a federal responsibility, but I do know for a fact that whether you're a chief councillor or a mayor or a minister of the provincial government, you do have the ability to go and lobby the federal government and work together to actually address this. Because you know what? It's getting worse. Even ambulance drivers and ambulance attendants are actually crying for help. We've got to relook at this right across the board.
All right, thank you, Ellis. Michael Lee, question to you now. Go ahead, you have a minute.
Well, Richard, as I traveled the province on this campaign trail, this marathon of a race, over 16,000 kilometers driven with my wife, Christina, I know that healthcare has been the #1 concern for members of our party and many members and supporters in various communities around this province. And I know in talking to many British Columbians that the challenge is this bloated, administrative, heavy burden type system that we have. It's not just about spending more money on healthcare. We're going to have to innovate. We're going to have to streamline. We're going to have to learn the lessons from this pandemic that's been putting such a high moral burden on so many frontline healthcare workers. But coming out of this, we have to enable choice. I know in representing the riding bank for Langara that seniors, for example, need choice in terms of the level of quality, innovation, and compassion they get in seniors care. Having worked and been part of organizations that have built seniors care facilities, we need that partnership, and that's the level of partnership we need with government.
All right, that's time there. Thank you so much. Renee, question to you. Go ahead.
Thanks so much, Richard. The healthcare system is on its knees, and COVID was like this bright light that shone through the gaps and cracks in the system. I will revolutionize healthcare. And in order to do it, we're going to need to consider every single option. We are in last place right now with our cancer outcomes, with our surgical wait times, with some of our health options, and we don't need to look further than our primary care system to understand why. When the NDP took over in 2017, we had 700,000 British Columbians without a physician. Right now, that number sits upwards of 800,000. That's an increase of over 100,000 people, while our population has only grown by a mere 200. That is unacceptable. And without primary care, yes, our ERs are going to be overrun with people who are too sick. Our nurses are going to be overloaded. And there are so many other ideas on how we could recruit, on how we could train, but that's where I would start, primary care.
And that is time. So Kevin Falcon, final word to you on this issue of healthcare. Go ahead.
Yeah, my mom was a nurse for over 35 years, and I've seen firsthand the incredible contribution that frontline workers make to our system. I'm the only candidate actually on the stage that served as a health minister for over 2 years and drove some pretty systemic change in the health system, trying to wring out some of the inefficiencies. My biggest concern now, having traveled the province talking to nurses and doctors, is this system is going to implode on itself. It is being so mismanaged right now, and I don't like to attack the government during a pandemic, but boy, what I hear out there really, really concerns me. We've got to have the courage to make change. I have that. To directly answer your question about for-profit care, this is a shibboleth that the NDP love to bring out all the time, try and create some fear that we're all trying to get a US-style healthcare system. Let me tell you, private clinics started under the NDP in the 1990s. They've always played a role in our system. That's where our WCB patients and union individuals go to get looked after. My focus is on what's in the best interest of patients, and I'm going to be focused our system to ensure that we focus on outcomes for patients.